How is everybody doing? And welcome back for another Strength Chat episode. Today, I have got a very special guest for you. Today, I'm joined by a doctor of physical therapy. Today, I am joined by the one and only Dr. Jacob Templar. How are you doing?
Great. Thanks for having me on to ask me to do this.
No worries at all. Thanks a lot for taking the time to jump on. How have you been? What have you been up to? What's been happening in your world?
Um, Not a lot. I mean, just all the same stuff. I mean, I'm doing some research right now on headaches. So I'm doing a follow-up right now, just waiting for some participants to send back their data. Right now, I have a string of clinical students. I've had just finished with my first of three for the summer, and about to change jobs actually to go to a hospital network to work more on teaching and mentoring other therapists.
Oh, cool. Is that something that you've been looking at for a while, or did an opportunity just come up to change things around?
Just an opportunity came up, and I didn't know when I'd potentially be available again to take something like that.
Yeah, because I suppose as well over the last year or so, the amount of teaching that would have gone on, and obviously, a lot of people might be sick of hearing about COVID and everything. But did that kind of change your schedule and day to day work?
Only in a like for a few months. And then it was surprising, like a lot of people still wanted to come in person. So I for like 2 months did telehealth, but then it was like business as usual after that.
Yeah, I think I know from the especially working in a gym myself with the gyms locked down, but especially with the the physio side of things, I think there's only so much that you can do online or over a Zoom chat. I think a lot of people still wanted to have that, or people have missed that kind of physical contact or communication with people.
Yeah. Yeah, a lot of people, it was like it was their social interaction too, so they really wanted to come in because they were like, yeah, I just like order my groceries online and or like do this, that, and the other thing, and like the only places I go are doctor's appointments, physical therapy, and that.
Yeah, I know. I had a client. She had recently moved to the area. Started a new job, started a new gym. She only met the people that she'd worked with over Zoom. And then her only social sort of like events was the gym, and then the gym got shut down. So it was kind of one of those things of it was a little bit of a double whammy all the way across. So I think the gym's being back open and a few more things getting back to normal has been pretty good.
Yeah.
Um, for everyone who might not know your background, and what you've been doing with the content that you put out there, can you just give a little bit of a background to yourself?
Yeah, so I'm a physical therapist. I graduated in 2016 from my physical therapy school, and in the US it's a doctorate level, so I have my doctorate in physical therapy. um, since then I've done quite a lot with like putting things on my resume, like getting certified in mechanical diagnosis and therapy, becoming a board certified orthopedic specialist. Done a lot of advanced training in sports and orthopedics. Worked with the strength guys, and then I think I'm probably most known for my content on Instagram. That can be, I guess I don't know a good way to put it, but I like to make evidence-based memes about physical therapy. So
Yeah. Will some of those memes be showing up in the mentorship that you'll be working with the other physical therapists?
oh, probably. I love to put stuff on slides to keep people paying attention.
So obviously, you mentioned there, working with the strength guys as well. Lucky enough to be doing, or I'm lucky enough to be doing an internship with them, and I followed them for a while. Is sort of the strength sports and the powerlifting side of things something that you've always been interested in, or have you had a look at other strength sports? What's sort of the background in terms of the training side of things?
Yeah, so I primarily started playing American football when I was in um, high school or primary school, I guess is what you guys call it, right?
It'd be, yeah, secondary school would be
Okay,
high school,
secondary.
yeah.
So I started playing, that, and then I mean, really wasn't that athletic or good at it. I was just a big kid back then. I used to be pretty overweight, and then was still like big size. Like I'm, 6'2", 6'3", and weighed about 250 pounds. Like at one point in high school, um, I got good at football though for my level of play, just by pretty much training. So I'd go in and strength train, do there's this program they had over here called Bigger, Faster, Stronger. So I'd go in 3 days a week, do like, it's like bench press, squats, deadlifts, power cleans, and then you like rotate three of them, maybe an overhead press, um, stuff like that, and then deadlift was in there. And you go through and you do that 3 times a week. Then I would do other lifts and stuff on other days, and I just like really enjoyed training. So I once I started getting out of football when I got into college is more when I got into the aspects of powerlifting and bodybuilding, and um, started off with like bodybuilding because I was very, very lean at that time. Um, and then gravitated more away from that as I found powerlifting. It was like, okay, I've lost a lot of weight, but I'm not really strong. And then um, try to do my best to gain muscle and get stronger ever since then.
Oh, cool. And is it a case of, do you work with quite a lot of, well, obviously, working with the strength guys, do you work a lot with powerlifters, or is it a lot more varied? Obviously, mentioning there yourself playing, American football. Do you work with quite a wide variety of a client base?
In person, like at my 9 to 5, I work mostly actually with very like complex, persistent pain issues. I'm most comfortable with, like spine problems. So I tend to be the kind of therapist that I want to see all the patients that like no other therapist really wants to see.
Yeah. Why is that?
I just have always enjoyed that more, and I found that it's very rewarding because often they're kind of marginalized the most. There's a lot of times where they're less believed by people because you can't see what's going on with them. Like they may look perfectly fine and not look in distress, but they're in lots of pain consistently. And then they tend to have other, I don't know if like quirks isn't the right word, but like they have differences about maybe who they are as a person sometimes too. Like I have few patients right now that are non-binary or have been like experienced like trauma because of healthcare providers or things like that.
Yeah, a few more problems to solve, and a few more things to focus on with that. In terms of the client base for your 9 to 5, how do you work as in terms of the physical therapy in the work that you do with the strength guys and a more sort of specific population in terms of powerlifters?
Yeah, so I we do like a video-based consults right now. Start with those well, as far as with the strength guys. Um, Start with like an hour consultation. I'll go through with people. They have a sheet like paperwork they fill out before I chat with them. Then I kind of have an idea what's going on with them. A lot of the questions I put on there are tailored more to give me information about what's happening with them.
Yeah.
So I have some like pretty good clues usually by the time I go in. We do like an hour talk, figure out what's been going on with them, see if there's some stuff we can do right away that can help them, especially if they're not training. And then based on like what I can see with them and things like that, I can help usually their coach also like, okay, what are the things we should do as far as progression? Like what's our timetable looking like? um, how did this happen? What we can change just in general about training or make it more comfortable. Then there's every once in a while you'll see me post on my story too. I'll reshare, especially athletes that like tag me in their posts, like when they're doing well in our return to sport.
Yeah. With that, obviously, a couple of things, kind of touching on what you mentioned there
Yeah.
in the questionnaire, trying to gather as much information as possible. And another thing that you said was, what can we do straight away? How far are they out from competition, or what can we do there? How sort of important is gathering all that information, and how does that influence your decision? Because sometimes they can, I've had it before that people can just focus on that one event rather than to take into account, okay, is it a case of have we had an injury in the past and we need to, that could play a part in it, and we need to have a look at how can we address that and strengthen up some of the areas, or we've done these exercises in the past and they've not worked, we're still doing the same exercises, so we need to take a different approach. What are kind of your thoughts on that?
Yeah, I mean that's a good way to think about it too, and especially if like they haven't maybe developed a bigger, like I guess the way we would phrase it is like a bigger motor around that area, like the ability to handle and tolerate more load and or volume in general. And especially the closer you get to a contest, like the more and more stress you would think somebody's under, right? So sometimes that plays a role in like why they start having pain now versus, you know, especially because an intensification block, sometimes the total volume might be less, but the loads are higher. Um, and it's about like practice, how much have they practiced at those heavier loads? How much have they practiced under this much pressure before? Are they used to handling it? Can they handle it well? Like somebody like um, Taylor and our other like really high competitors are just like can handle the stressors involved with competing very well and perform very well.
Yeah.
Um, so those are different things that I'll look at too.
Yeah. And how much, because you touched on there, speaking with the coach as well, how much sort of how does that communication work? Because sometimes you can see coaches trying to step over into the physical therapy world, which is sometimes, I know for me as a coach, I would much rather work with people who are experts in that area, who have a little bit more knowledge, and then work together as a team. How much from what you get from the athlete do you also speak with the coach, and then reach a middle ground? Or is it a case of, look, I'm not willing to budge on this, but we can have a look at some other things?
Yeah, I mean, I think it's a bit of a give and take, right? It just depends on. I would say I have like a pretty good, at least working relationship with all of our coaches. Um, so it's usually like they are wanting to know, like, okay, what should we do? Like they want to make sure that their client is getting best value for like what they've paid for. I would say our coaches really care about their athletes a lot too, so they don't want to see them um, dealing with this, not able to do the things they want, and
Yeah.
the things that they're paying for. So most of the time they're like, okay, what do we need to do? Like, do we need to shut things down? Or are there alternatives we should be doing? Um, what can we do? So we'll have a discussion about those things. And a lot of times our coaches are already doing a lot of things that I might have already recommended in training. Um, Especially because I think we're going into almost my third year. So I've seen the influence that like me being on the team for so long has had, and the number of consultations I've had have like steadily like gone down, which is like great to hear, but it's, you know what I mean? It's like you only get paid for work that you do, but
Yeah.
I'd rather have less consults because of influences that I've had to help, help us build that better athlete.
Yeah, just on a little bit of a tangent from that, because I know there's a couple of physios that I work with and recommend, in Leeds. However, I've had some clients that have gone to physios and they seem as though they're always going back, and they never necessarily get an answer, and there's never a solution. Do you think it's a case of having confidence in your own abilities, that you're there to actually fix somebody or get them out of pain, or allow them to get on with what they do? Do you think sometimes, in terms of physical therapy and physio, that's what sometimes they can struggle with, because it's trying to balance that thing of, right, well, actually I need them to come to run a business, but equally, I want to make sure that I'm actually fixing them to build that reputation.
Yeah, I think it's a bit of both. Like I definitely see with people that I've worked with in the past, like people like therapists can be afraid of pain. They can be afraid to address issues that like somebody's not specifically coming in for or hadn't mentioned, like for their, what they were assessed for and things like that. Um, they're not as confident in their abilities sometimes, and that makes a big difference because a lot of times with people that I'm treating like 9 to 5, I don't have like a diagnosis, or even with the consultations I do, because some of the people are from countries where maybe their medical system isn't great. They don't have like access to go see a physician consistently, things like that. Um, we have athletes on every single continent, so it's like also thinking like, okay, let me at least make sure this is something that I should be at least talking with somebody about, rather than, okay, maybe they didn't have access to some certain kinds of medicine, and they have an issue that I would not be experienced with because people where I live just don't experience that kind of thing, or the lifestyle is different there, things like that. And therapists a lot, yeah, it's a double-edged sword. Like, some of them are really skilled and know what to do to like help people, but then others lean into this aspect of creating dependency with people, which you can see that's like traditionally thought of with chiropractors. That, okay, I want to keep them coming for a long time because it helps my business, rather than going, okay, what can I do to help teach this person about what's going on with them, and then help them to make the changes like going forward, or preventatively, reduce their risk for sustaining this injury again.
Yeah. Do you think that's because, especially, speaking about two different types of clients there, the clients that you're working with 9 to 5, the power lifters that you're working with, do you reckon the approach and how much, trying to potentially spending a little bit longer and taking a little bit of a slower approach? I don't want to use the word gently, but a little bit more, right, let's take our time a little bit, compared to, you mentioned some of the top athletes that work with the strength guys. Do you reckon it would be a little bit more of, right, okay, we're going to be a little bit more aggressive in our approach to make sure that they're going back to performing?
Yeah, I tend to be, it's like either one of two things, right? So I either have them keep training the same, and then I have them do other things which I'm like seem very like trivial almost sometimes, and they either respond really really quickly, or it's that I'm very aggressive in like giving them something that I wouldn't recommend for people right away normally, but because their body's used to so much more like physical stress from the amount of weight that they lift all the time, it's like, okay, let's be way more aggressive. And sometimes it depends on the person's mindset too, like things that I feel out from them when I'm having like a talk with them, um, stuff like that, see how where they're at. um, so it's usually one or the other, it's never like usually in between. It's I'm
Yeah.
usually either extremely aggressive, or um, I'm like, okay, this seems like it's responding really quickly, so let's pretty much not change anything, and kind of like take certain things that I might add to what they're doing, like in their program, that would be traditionally looked at as being like a physical therapy kind of exercise, and being fairly like, seems like adding almost nothing.
Yeah, you said there, obviously the mindset side of things when you're speaking to your clients and the athletes that you work with, and you're either one or the other, quite aggressive or a little bit of a slow approach. Do you think when you speak about when you talk about the mindset and see where the client or the athlete is, do you think they have that mindset as well? They either want to take a little bit of a slow approach or be aggressive in their approach. There's no sort of in between, because it's a little bit like, I always liken it to sort of like stress management. Some people want to go in and knock hell out of the boxing bags. Other people want to do like breathing drills and a little bit more relaxed. Do you find that excuse me, that's a similar approach with the clients and athletes that you work with?
Yeah, I mean, you'll find people, and it depends on like what they think about their injury too, and like how they feel about it mostly. Because some people can be quite hesitant because they're like, okay, I'm not so sure about this. Like, maybe they've had this issue, like we were talking about earlier in the past, um, or they might have been and seen like providers that I wouldn't necessarily agree with, like things that they had told them, which colors how they might feel about what's happening now, and then their ability to perform going forward, whether that's good or bad.
Yeah, and another thing on there it's saying about, which kind of goes nicely into the next question, is in terms of how they feel about about the injury. And it was actually, I think you put a post about this not so long ago, the difference between feeling hurt and injured. And it's one of those things of, especially when we're looking at the strength sports such as powerlifting, like, it's tough, the amount of weight that you're going to be lifting, the amount of stress that you're going to be under. There's going to be I don't know whether you would call them niggles or times when you're going to be feeling
Yeah.
a little bit beat up, as opposed to times when actually, there are going to be actual injuries where we're going to have to drastically change training. Whereas feeling a little bit beat up, you can still train. It's just hard. You just have to, make sure that we're fueled enough and get enough recovery in. What's the difference between the two? And do you think, people, clients and athletes, can get them mixed up or misunderstand them because of sort of misinformation?
Yeah, I mean, I think for sure, like to start, I'll answer the latter part, but like they definitely can be confused and mixed up. I tend to see this less in powerlifters, although I have had some consults where I'm like, kind of like, yeah, this is just like you're sore, like you did something that you weren't quite used to, or they want to like. I've seen this too, where people go off program and they weren't quite ready at that time with a total amount of stress in their, um, that they had been accumulating in their blocks, and then they go off program and it's like, well, yeah, you weren't really recovered well to try and max out right now. Um, Things like that. So, and that's the thing, right? Because I would say hurt is like you have some stuff going on, but it doesn't prevent you from doing anything. It doesn't um, cause you to change your training in any way. Like I've had on and off occasionally, like my right knee will get like uncomfortable or sore or even hurt times when I'm like squatting or things like that. But I'm like the because of my profession and all the things that I know about like the nuances of pain in the human body, I'm like, okay, that's not an injury, and I keep training, and it goes away usually within a couple days. Or the big one that I've been dealing with lately is occasionally my pec on the left will be sore. Um, and if I was a different person, I would probably actually modify the weight and stuff that I do, and change something about my bench pressing. But I added weighted push-ups with my like feet up, and um, have been doing, actually I progressed and have hit heavier weights than I've ever hit in the past on my bench press just recently for sets for triples. And I'm like, if I was someone else and didn't know what I know, I would have like totally, scaled back what I was doing because my pec hurt.
Yeah. Do you think with that, it's funny, yours is the left side, mine's usually the right side in the build up to a competition. So when I go and see the physio and have like a massage or anything on my right side, it's painful at the time, but I'm like, oh yeah, I'm quite glad I went for that. Do you think, especially when you mentioned there about sort of your knee and the left side of your chest, do you think these are just red flags or something to keep an eye on? And do you think sometimes people can be react too soon rather than seeing how it goes, like with your knee and your pec? Right, actually, I can still work through this if I keep training. It's just one of those things that, right, okay, it flares up, but it's not anything major to be focusing on. And if they do dial it back, do you reckon people are actually doing more of a hindrance than a help in terms of actually progressing with their training?
Yeah, I mean, so it's the same thing with the difference between hurt and injured. Like there are definitely times where I think some people go too soon to get help. Um, as far as like with time, most things get better, and if you were like regularly training and like hitting a lot of compound movements, you're gonna probably train through a lot of things that would be what things that I would recommend anyways. Like with rehab, um, like I have some people come in that are lifters in my 9 to 5 or recreational athletes, and I'm like, okay, here's your like PT like exercise that we're doing like sometimes to reduce their symptoms. But then I'm like, otherwise, I want you to just keep doing what you were doing before, because those are all really good exercises to like strengthen around this area and develop more conditioning. Um, yeah, people definitely do sometimes go in too soon. Um, but on the same time, every once in a while, I see people that like waited too long, like they're taking uh, medicine like every single day, like several times a day, or like completely like changing a lot of things about their life to accommodate this issue. And like those are situations where once you get to that, if you get to that point, you really should have seen care or sought somebody out. But there's a lot of things you can do. Usually, it's like, is it sharp pain? Does it like, how long does it last after your activity? Like, do you notice it in other times of the day? Those are times where I would like more, okay, now go see somebody. Or, if it particularly like pain persists like 15, 20, 30 minutes after you get done working out every single time, okay, maybe that's a sign to go see somebody versus you can train, do all your normal stuff, and then it typically dissipates.
Yeah.
Especially like tendon issues, they benefit from you consistently moving rather than dialing too much back.
Yeah, with that, when you mention about before it gets to a point where people are going to go and actually see somebody about it, do you think sometimes it is a case, just touching back on the mindset side of things, that people are okay to feel hurt, but they never want to hear that right now you're actually injured, because people think it's the next stage of, oh, if I'm injured, thinking from a more of a team sports background in rugby or football or American football or anything like that, that means if people are injured, then they're not going to play on a Saturday and a Sunday. In terms of the strength sports, you could be hurt, you could have a slight injury, but what we've spoken about there is, if we take a little bit more of an aggressive approach, there are still things that you can do and you can still perform. Do you think the mindset side of things, that people don't want to hear that, right? You're injured, because of the effect that it'll have on their mindset and what they think will have on their training?
Yeah, I mean, especially with power sports, right? Like the athletes that we work with obviously have a lot of time invested and are at a high level. So it's like a big part of their identity. Like nobody wants to be like, go to somebody and have that part and be like, hey, this thing that you really enjoy to do and you get a lot of gratification from, like, yeah, you're not going to be able to do that. Like, even though, maybe you were set to break some like records or place really well at your next meet and it's like in 6 weeks, like, yeah, hey, you got to shut it down. Um, that and then what's the other part? Oh yeah, like especially like athletes, a lot of times are afraid that you're gonna tell them that, and I find more often than not that it's something we can still train through and do, and not affect their performance or sometimes get it better. Like I was working with elite level um, teenager in football. For Americans it'd be soccer, um, where they had a groin injury, and I was like, yeah, this is not something that I would even remotely say that you should stop doing anything with. I was like, if anything, we just need to add the right things for you, to make sure that it's getting better. And then like within a month and a half, um, he felt fine, like completely better. And then I was just like told him, I was like, yeah, this is going to be boring, but pretty much here's these exercises you have to strengthen this area. And you're going to have to just do these for like pretty much ever. Like as long as you keep playing football, because sometimes tendon issues actually take a long time to like biologically be like 100%, so far beyond when somebody's going to have symptoms. And then this kid's at a high level, so he's going to be playing for a while, hopefully.
Yeah. With that, in terms of playing at a higher level, he's going to have maybe not experience if he's still quite young, but experience playing at a higher level. I can imagine he's probably going to have a little bit of a higher level coaching and experience playing against other more elite, if you like. Do you think when it comes to feeling hurt and injuries, that the experience level of, like what we touched on at the start, of injury history, experience of having injuries, makes it a little bit easier to, if you say, right, these are the exercises that you need to do, that just get on and do it, as opposed to the experience of never have, like, people's first injuries or first feeling of being hurt, as well as the experience of how long have they actually been training for and what their level is, if that kind of makes sense.
Yeah. I think it's a same thing. That it is. There's going to be lots of gray in every answer that I give. So it depends on the mindset, was what I find. Like I've had patients that have like never been athletic day in their life, and then they like are very like nonchalant about their injury. They're just kind of like, whatever, it is what it is. Like they don't really care. And then I've had other people on the same end of the spectrum where I like go and hand them like a weight and they're like, it's like 5 pounds. They're like, oh, this is heavy, or they get sore and then they blame you for you hurt them more, even though they got delayed onset muscle soreness. Um, and then at the opposite end of the thing, I've had very good experience, like athlete clients that have, they understand a lot of good information. They know like how to push themselves, how to communicate what's going on well. They're confident in their body. They just want help to like get further. And then there's some that like they have sometimes a small injury, but obviously that's very subjective, right? But then it causes them to have almost like a crisis of like, and kind of have a lot more anxiety and stress about the issue maybe than I might expect.
Yeah, it's interesting that you said there, like a small injury, and it's kind of one of those things that someone else's the weight. One weight is going to be light for one
Yeah.
person, one weight is going to be heavy for the other, and it might be a little bit of a tangent, but is there sort of, and when you said there's a little bit of like grey area of, is one person's injury another person's hurt, or is there a distinct line where like, right, this is actually an injury, if that kind of makes sense?
Yeah, I think up until a point, like there can be anything that's, I mean, most of the things that are probably musculoskeletal um could be like one person's injury could be another person's hurt. The only distinctions where I would say that probably like starts to go away is like when you actually get into like where somebody has like a traumatic like ligament tear or muscular tear or things like that, which are far less common, at least at the practices that I've been in, than other things where it would be more likely to be like hurt versus injured, kind of deal.
Yeah.
Like somebody tears their ACL, like you can definitely rehab, and they're starting to show, some Australians that I know um, are showing that tissue can heal with rehab and specific bracing. But it's still something that would, take you out of sport.
Yeah, definitely. I kind of want to touch on that because it isn't a case of you hear people say, "Oh, yeah, I'll just walk it off. It's fine. It's fine." Whereas actually, there's going to be some things that, okay, yeah, we're not going to be able to not going to be able to move it from there. And on that, is it a case of, is it the outliers or the sort of an anomalies where their bodies, because obviously we mentioned about like Taylor Atwood for the strength guys, an awesome level of strength, the amount of stress that his body can be put under in terms of the weight that he's lifting. Are those few and far between in terms of people who can hold a lot of hurt, if you like, and it's going to take a lot more to try and break them in terms of injuries. And when people see that, when people say, especially on the social media side of things, of, oh, well, I had this injury or that injury and it only took me X amount of weeks, do you think people's expectations are, for people coming into the sport, or people just starting out in training, think that, oh, well, actually so and so had this, so it's going to take a long time for me to ever get hurt or get an injury as well?
Yeah, I mean, I think that does happen. And the thing is like, because we're so involved with like these kind of sports, like barbell sports, I guess I should say, because that encompasses a lot of different areas. Um, that we're so like tuned into our area that we don't like sometimes realize that the injury rates for our sports are extremely low, like lower than any field sport. And bodybuilding and powerlifting are actually the two lowest sports with the lowest injury rates. Um, so it's definitely like something that if you train in a very sustainable way and know kind of like how to program well and how to like listen to specific cues, you can go a long time without ever having any serious issue, or still do a lot to still train, even though you might have a limitation and issue. Um, one of the things with different powerlifting wise is you're just thinking more about the specificity of, okay, I have to bench, I have to squat, and I have to deadlift. So out of order. So squat, bench, and deadlift. Um, so you may not be able to be ultra sport specific, which is sometimes easier for novice lifters than it would be for, say, like high level elite lifters where you want to try and be as specific as possible. But this still leaves you a lot of room to be able to accommodate an issue and still make progress and see lots of strength gains and still perform. Versus like bodybuilding, it's like, um, I almost sometimes like to work with bodybuilders because it's like, okay, well, we know we just got to hit this muscle group and stimulate it enough. So there's a lot more room for, okay, different things we can do or add. Okay, how does this feel? How does that feel? Or our powerlifters sometimes that are in off season that'll still be working with our coaches. It's like, okay, I have a whole lot more um, like variety that I could potentially think about because we don't have to be as specific.
Yeah, it's interesting. It's interesting saying that, and I'm glad you mentioned about bodybuilding and powerlifting has the lowest injury rates, because it's one of those things where you start speaking to about to people, and everyone knows maybe a horror story of somebody's got injured doing barbells, but actually like what you mentioned, if you focus on good technique, have good programming, you're gonna the people that are successful in the barbell sports are those that don't get injured. And I know it gets thrown around quite a lot in terms of the just do the basics, make sure that we're having good technique, getting good resting, getting good recovery. However, it's the people that are always, I think you touched on it earlier in the chat, in terms of, oh well, I'm gonna max out today, right? Okay, well that's not really how it works, because then you're gonna injure yourself. And it's especially from the maybe sports that potentially have maybe a little bit more money in them, such as football, rugby, those sort of sports. You see those injuries, and we touched on it before. They're going to be out. They're going to be out for a long time. Going on to sort of the next question that I had, in terms of building robustness, and the exercises that you might give to athletes and powerlifters to prevent injury. How much of that is, if they are getting the basics done, in terms of, they've got good technique, the programming is pretty sound, the managing their recovery, is robustness needed? Do you need to put those exercises in? And is it striking that balance between, not having them in and then potentially they do get an injury, or have a few in to make sure that they don't get an injury, if that kind of makes sense?
Yeah. So if they've had like a specific injury, sometimes I'll add like specific things, but there's only really a few exercises have been shown to really like work well for injury prevention. And those are like the Nordic hamstring curl, like the Copenhagen side plank. Um, I'm not sure if there's anything yet as far as the quad goes, as far as doing those like reverse quad. They're almost like Nordics, but in reverse.
Yeah.
Um, those kind of things are really the only ones that have been shown to have like huge benefit. Otherwise, it's like Jason and I have talked about this where he'll do stuff in like early phases or like volume blocks. He's essentially trying to build somebody's motor, like make it so that they can crank up way more, the engine block, essentially, if you can think of it in like terms of mechanics. Like we're trying to make that engine block really strong. So when we need to put a lot of horsepower into that thing, it can really handle it and it just doesn't fall apart.
Yeah. With that, because especially there's only a handful of exercise. You mentioned there a handful of exercises that would actually work. Do you think then, with that sort of train of thought, because I know we've mentioned about the team sport side of things, that we want to make them robust, ankle stability, because there's going to be a little bit more running and all those sort of things. More specifically to the powerlifting side of things, do you think robustness is actually a thing? Do you think that there needs to be, a lot more emphasis put on these exercises, when you've said there's only a handful that actually work?
I think the biggest thing would be that in more off-season times, or while somebody's still like a novice or intermediate, like getting exposed, like doing things with programming to develop like your work capacity, and then um, your like variety of exercises maybe too. Like even if you don't change your compound main lifts, but like being exposed to different for variation in like trunk angle and like leg position, things like that with your accessory work, I think would go a long way to developing like if you do get out of position with a lift, like now your body isn't going, hey, I know that we normally perform everything in this like specific range, but uh, and now we're out of that position. So you know what? We should definitely be hurt right now. So getting those exposures to like different joint angles and positions, like the ligaments pulling, things like that, are definitely still useful. And spending some of that time, especially in off season when you're newer to the sport, um, not being afraid to experiment and explore with exercises that you don't necessarily wouldn't always do. And I think that's what would develop more of that robustness for sure. And making sure that you don't actually like skip doing some cardio once in a while. And maybe adding in some of those things like meditation, like, to help you learn better coping strategies. So that way, whenever, because there's this habit where athletes are in just in general, people in powerlifting and fitness, they just want to add more all the time rather than going, okay, what things outside of the gym can I do that would help my recovery?
Yeah, I think that's it doesn't matter how many times we talk about training, about lifting heavier or anything like that. It always comes back down to you still need to be able to recover. You still need a good night's sleep. You still need to make sure that you getting good food in and focusing on those things. And yeah, I think it's always going to come back to that, because you can have the best program in the world and have the best things laid out in the gym, but if you're sleeping rubbish, actually just getting a few extra hours sleep or a little bit more better quality sleep is going to allow you to make progress. And that's probably an injury prevention tool in itself, making sure that you're getting plenty of sleep and plenty of rest.
Oh, it's
In
like
turn,
one of the best actually. They've done studies on it. Like if you get less than 6 hours and sleep at night, you're gonna like there's like it's like a 4 to 6 times more likely to get injured. And
right?
if you get an hour and a half extra, they found that it significantly enhanced somebody's performance, like the most of anything that you can do acutely.
Yeah. Well, then you always get that look of, what, as your coach, you're asking me to go to sleep and sleep more. Yes, that's exactly
Yeah.
what I'm doing. Like, it could be better. That's much better than saying, right, you've got an extra 4 sets of whatever you had. No, actually, let's focus on some sleep. One thing that you did mention there, obviously, with the handful of exercises that are going to actually help with injury prevention, and focusing on things such as cardio, such as sleep, such as nutrition. Do you think sometimes, and this was sort of earlier on in the chat that we mentioned about sometimes coaches stepping into the physical therapy world and the physio world? Do you think sometimes it is a case of coaches throwing in exercises that are for robustness and injury prevention, if you like, to kind of mask the programming of oh well, if we put those in there, I'm trying to cover all the bases, rather than thinking, right, okay, if we have sound technique and sound programming, I don't need to put them in there, because from having what's actually going to get them results to then throwing in loads of prehab or rehab, or whatever you want to call it, throwing it in there just for the sake of throwing it in there, which is just adding time to the session, where we could be dialing in technique and adding more volume in, and progressing the lifters that way.
Yeah, I've definitely seen that. Like I had a client one time, they were doing like a 30-minute like warm-up routine. And then they'd be like, they would tell me that they felt really spent afterwards and they were unsure of like dialing that back. I like that was like the first thing I asked them to do. I'm like, okay, this is taking you half an hour. We need to like reduce that. And then like I was like, okay, we're gonna do like 10 minutes of cardio and these very like specific things before their session rather than like a lot of these things that would then cause them to be really fatigued going into their session. They were like, you know what? Like I was really afraid to do that at first, but I actually feel much better having reduced the volume of amount of things that we didn't seem to be as necessary.
Yeah, I think sometimes people can be a little bit too precious about exercises, and think, oh no, I'm gonna have to keep these in there. Whereas, especially when we are talking about powerlifting, it's the only sport where the training is the actual sport, and that's what we need. That's what we need to be focusing on, because there's only so many things that you can do before you train, until actually, at some point you're gonna have to get underneath the barbell, and you're gonna have to, squat, bench, and deadlift, and work on the technique, work on the technique side of things. Do you find that the case, or have you found that when people are speaking that they've got a certain exercise that I can't take this out, I feel good, I feel good doing that, rather than it's actually doing something that's going to benefit their training?
Yeah, I mean, if it's like one or two things, like I don't mind it because I'm like, okay, it's probably harmless. And if they feel better, like mentally with that, and it's sometimes easier to like plant seeds about that kind of thing and like let it blossom on its own, um, rather than like forcing them to take it away. So it's like, okay, yeah, maybe you got this one thing, it takes you like less than 5 minutes. Let's just keep that in. Here's the specific things that I want you to do. And then let's get under the bar because that's what's going to help you warm up the best, honestly. Like, I mean, I go, and not saying that everybody should just do what I do, but when I squat, bench, and deadlift, I go into my home gym and just get under the bar for a set. Then I mean I ramp up pretty quick too. So I'm doing like um maybe 50% for like whatever I'm supposed to do that day for certain like I do if I'm doing like sixes and I do a set of six, I'll do a second set of six, a set of four, and then usually I'm like at my weight and I've started my set. If I'm doing triples, I just do triples all the way up until I get to 90% of whatever that weight is. Then I do a single and then I'm training.
Yeah, yeah. I think it's a similar approach to, when you're speaking about nutrition. A few things in there that people are attached to. As long as we get the stuff that we need to get in there, it is gonna benefit performance. And when you mentioned in there as though you ramp up quite quick, especially when you mentioned about that one client who had like a 30-minute warm up. Why everyone gets involved in powerlifting, in barbell sports, in training in general, is because they enjoy training. Nobody ever, enjoys training because of the warm up. It's the things that come after
Yeah.
the warm up that people are enjoyed. But sometimes, it's been some kind of a common theme throughout what we've chatted about, is also always the mindset and the personality of the person. And if it's fallen back to, again, at the start of the chat that we mentioned about there, that's why it's important to have a look at their injury history, because then might know why they've been a little bit more attached to that warm up a little bit more, rather than giving them the confidence to be like, right, okay, this is what we can work on, and this is where we can go, which is going to improve your performance. Quite a lot of topics and a few tangents thrown in there. But the last question that I like to ask is, from everything that we've chatted about there, what would be your take home points or words of wisdom?
Let's see. I probably would say get more sleep, eat more protein, drink more water, do some cardio. Um, and then, spend some time. I guess the biggest thing would be is like to encourage people to learn more about even if they learn more about pain, sometimes that will help you with an injury. To have a better mindset and understanding and know how to like listen to your body, but like in the right ways. So like even if the least amount they did was go watch this TED talk that Lorimer Mosley did like years ago now, like that, or watch something that David But these are names of like neuroscientists that specifically study pain, and they used to be physical therapists. David Butler and Lorimer Mosley have tons of information on YouTube that you can just put in their name and pain, and you're gonna find all these like lectures they've done, all over in Australia that are just filled with like great information.
Yeah, I think that's a good thing to finish on. Just being able to understand your own body, and have a little bit more information. I know from the clients that I've worked with that come in, especially beginners, where do you feel that in the exercise, and they point to a completely different place to where they should actually feeling it. As basic as that, and then that'll follow you throughout sort of your lifting or training career to have that information a little bit more, especially from the coach's side of things in terms of the programming. I want people to know why they're doing it and have an understanding
Mhm.
of it. And the same from the, the physical therapy side of things. It's no good just going, oh, actually, do you know what? Yeah, I'll take that as a given as what you've said, and then you're still none the wiser. You've just been doing those exercises, aren't feeling anything, don't know what you're doing, and then you're not progressing, and then that's where you're probably going to end up going back. So yeah, I thought that was a good point to finish on. Thanks a lot for taking the time
Yeah.
to jump on, and enjoyed the chat that we've had. If anyone's got any questions on what we've chatted about today, or want to see the content that you put out there, where can people find you or reach out to you?
Yeah. So the best place to always find me is going to be on Instagram. I have like been slow to do anything like people have told me to get on TikTok or Twitter or whatever. I'm like, I know Instagram. And so I'm on there as at strength in evidence. So it's strength in evidence underscore physio. I once said it to somebody and they thought I said and then they couldn't find me.
Awesome. For everyone listening, 100%, go and check out the content that Jacob puts out there. It is really helpful. And as well, I'm a big fan of a meme. So if you like a meme, that'll be beneficial. That's just a bonus. Thanks a lot for taking the time to chat with me. Really enjoyed chatting with you today. Thanks a lot to everyone listening, and I will see you all next week.